Hi everyone, my full name is Phạm Hoàng Kế Bảo. Here are my group 3. We are going to talk about the medicine and our topic is public and private healthcare in Vietnam, a medical perspective. First of all, let's watch my video together.
Hey bro, what's wrong with you?
My son is seriously ill, and I don't know which hospital are better in Vietnam, particularly in public or private services in long-term treatments.
Oh, I think you should choose public hospital because it has experienced doctor and lower cost.
No, private hospitals are faster survive and modern technology.
I think it depends. For serious illnesses, public hospitals are much safer, but for checkups, private hospitals are more convenient.
But I think it also depends on the needs and budget. Not everyone can afford private healthcare.
Yeah.
Public is better.
Depends.
Public?
It depends.
Depends.
Stop! And I even don't know which is better, public service or private in Vietnam. Yeah.
First of all, health is one of the most important things in our life. When we are healthy, we can study, can work and enjoy the life. We can spend time with our family and achieve my goals. But when we get sick, everything becomes more difficult and even simple daily activity can be challenges. Yes, that is why medicine plays an important role in our society. Yes, medicine is not only about the doctor and hospitals. It's also about how people prevent disease, how doctors diagnose health problems, and how patients receive treatment. For example, people can prevent disease by eating healthy foods, exercising regularly, and getting enough sleep. They can also go for regular health checkup to detect the problem earlier. When they feel unwell, they go to hospital to get medical help and advance. In Vietnam, people face various health problems, from common illness like influenza to serious disease like cardiovascular disease. Some people with a long-term condition, such as the patient with require continued care and monitors. Because of this strong healthcare system, it's very important to protect people's health and improve their quality of life. When people have symptoms like fever, cough, or pain, they usually go to the hospital or clinics. In Vietnam, these medical center can divide two main types: public healthcare and private healthcare. Public healthcare is managed by the government. It plays a crucial role in a country because it serves a large number of patients every day. You know, public hospitals provide essential services such as medical checkups or blood tests, vaccination program, and treatment for many diseases. On the other hand, the private healthcare is run by companies, individuals. In recent years, private hospitals are become more popular, particularly in some big cities. They provide better service and short waiting time and more comfortable environment for the patient. Many private hospitals also use a modern medical technology to have a doctor make faster and more accurate diagnosis. From a medical perspective, both systems are necessary. Public healthcare helps treat a large population and manages serious disease, while private healthcare improves the service quality and spot early diagnosis with advanced technologies. So, an important question is that which system is better for patients in Vietnam? To answer this question, we will compare the public and private healthcare based on several medical aspects. Firstly, diagnosis, or how doctors identify diseases. Secondly, the treatment, or how patients are cured. Thirdly, technology such as medical machines or equipment. Fourth is cost, or how much patient need to pay. Last but not least, patient care, which refer to export and service patient reserve. By examining these aspects, we can better understand the strengths and the weaknesses of each system. Well, now let's begin to the public healthcare.
My name is Huyền Trang. Now I will talk about public healthcare in Vietnam from a medical point of view. Public hospitals play a very important role in the healthcare system. Every day, they treat a very large number of patients, from children to elderly people. These hospitals are responsible for managing both common diseases and serious medical conditions, so they are very important for the whole population. For example, public hospitals treat common illnesses like influenza, infection, and fever. At the same time, they also handle serious diseases such as heart disease, cancer, and emergency cases from accidents. In many cases, public hospitals are the first place people go when they need urgent medical help. One of the biggest advantages of public healthcare is affordable treatment. Patients can use health insurance, so the cost of services like blood test, X-ray, and basic treatment is much lower. It is very important for people with low income because they can still receive medical care when they are sick without worrying too much about money. Another advantage is that public hospitals have many experienced and skilled doctors. These doctors are well trained and have a lot of experience in treating different types of diseases. They can perform complex medical procedures such as surgery, emergency treatment, and long-term care for serious patients. Many of the top medical experts in Vietnam work in public hospitals. Public hospitals also play an important role in disease control and prevention. For example, during outbreaks like COVID-19, public hospitals help test patients, provide treatment, and control the spread of disease. They also organize vaccination programs and health campaigns to protect the community. In addition, public hospitals are important for medical training. Many medical students and young doctors learn and practice in the hospital, which help improve the quality of healthcare in the future. However, public healthcare also has some challenges. First, hospitals are often overcrowded because many people choose public hospitals. There are too many patients. As a result, patients may have to wait for a long time to see a doctor or get test results or receive treatment. Second, doctors and nurses are usually very busy. They need to take care of many patients in a short time. Because of this, they may not be able to spend enough time with each patient or give detailed explanation about diseases and treatment plans. Third, in some hospitals, especially in rural areas, medical equipment is limited or not modern. This can make diagnosis slower or less accurate compared to hospitals with advanced technology. Another problem is that the hospital environment can be crowded and stressful. which may affect the patient's experience during treatment and recovery. In general, public healthcare in Vietnam is very strong in treating a large number of patients and dealing with serious diseases. However, it still needs improvement in areas such as service quality, waiting time, and medical technology.
My name is Yalin. Next, I will talk about private healthcare in Vietnam from a medical point of view. Well, first of all, in recent years, private hospitals have become more popular, especially in the big cities. You know, many people choose private healthcare because they want a better service, faster treatment, and a more comfortable experience. Actually, this trend is increasing as people care more about their health and quality of life. Now, let's look at the main advantages of private healthcare. First, private hospitals are known for high-quality medical services. In general, they focus on patient satisfaction and provide a more personalized approach to care. So, patients usually feel that they receive more attention and support during their treatment. Next, let me see. One important advantage is fast and accurate diagnosis. Private hospitals usually invest heavily in modern medical technology. For example, they use machines like MRI, CT scan, and other advanced imaging systems. Because of that, doctors can detect diseases earlier and more precisely. So, what does it mean? It means patients can receive treatment at the right time. And it is especially important for serious diseases like heart disease or long-term conditions like diabetes. Moving on, another advantage is better patient care. You know, doctors in private hospitals often have more time to talk to patients. They can explain the patient's condition clearly, answer questions, and suggest suitable treatment plans. Because of this, patients feel more confident and less worried. Private hospitals also provide good care for chronic diseases like diabetes, as well as regular health checkups. Through these checkups, doctors can detect problems early and help prevent serious diseases in the future. Also, the hospital environment is usually clean, quiet, and comfortable, so patients feel more relaxed during treatment. As a result, this can support faster recovery and improve the overall experience. Now, let's take an example. Some private hospitals also offer international standard services. Hospitals like Vinmec International Hospital, FV Hospital, and Climate Medical Corporation are well known for their modern equipment and high-quality care. In fact, they often follow international standards in diagnosis and treatment. However, let's be honest, private healthcare also has some disadvantages. The biggest problem is high cost, right? Medical services in private hospitals are often very expensive. For instance, advanced tests and treatment require a lot of money, so not everyone can afford it. Another point is that private hospitals may not always handle very serious emergency cases as effectively as large public hospitals. In some situations, patients may need to be transferred, and also most private hospitals are located in big cities, so people in rural areas may not have easy access. This creates a gap in healthcare quality. So, To sum up, private healthcare in Vietnam is strong in service quality, diagnosis, and medical technology. But at the same time, it is not accessible to everyone because of its high cost and limited availability.
Hello, my name is DH24NNA. Now I will compare public and private healthcare in Vietnam from a medical perspective. First, let's talk about diagnosis, which means identifying a disease. Public hospital can diagnose many different diseases, from common to illnesses like influenza to serious conditions like heart disease. They can have experienced doctors can perform many types of medical tests. However, because there are so many patients, the diagnosis process may take more time. Patients often need to wait in long lines for tests and results. In contrast, private hospitals provide faster, more detailed diagnosis. They usually use modern machines such as MRI and CT scans. These technologies help doctors detect diseases earlier and more accurately. As a result, patients can start treatment sooner and which can improve their chance of recovery. Second, let's look at treatment. Public hospitals are very strong in treating serious conditions and emergency cases such as accidents, injury, or critical illnesses. They have large medical teams and a lot of practical experience. This makes them very reliable in difficult and life-threatening situations. On the other hand, private hospitals focus more on comfort and personalized treatment. Doctors often spend more time with each patient and design treatment plans based on individual needs. This is especially useful for long-term conditions like diabetes, where patients need regular monitoring and support. About medical technology, public hospitals in big cities may have modern equipment, but in some areas, especially in rural regions, the technology can be limited or outdated. This may affect the speed and accuracy of diagnosis. Meanwhile, private hospitals usually invest more in advanced medical technology. They often update their equipment regularly to improve treatment quality. This helps doctors work more effectively and increase patient safety. 4. Let's consider patient experience. Public hospitals are often crowded and stressful. Patients may have to wait a long time, change rooms, and deal with a noisy environment. This can make them feel tired and uncomfortable. In contrast, private hospitals are usually quieter, cleaner, and more comfortable. Patients receive more attention from doctors and nurses, and overall, the environment is more relaxing. This can have positive effects on both physical and mental recovery. Finally, we can also compare accessibility and cost, which are very important in healthcare. Public healthcare is more affordable and widely available across the country, including rural areas. This makes it easier for most people to access medical services when they need help. Private healthcare, however, is more expensive and mainly located in big cities. Because of this, not everyone can use their services, especially people with lower income or living far from urban centers. So, from a medical point of view, public healthcare is strongly in capacity experience and emergency care, while private healthcare is strong in quality, speed, and medical technology. So, both systems have their own advantages and limitations. Let's play a different but equally important role in improving healthcare and protecting people's health in Vietnam.
Hello, my name is Jamie. Now let me summarize the key points for public and and private healthcare are very important in the field of medicine, although they are different in many ways. They work together to create a more complete and effective healthcare system in Vietnam. Public healthcare plays a key role in protecting the health of the world population. It helps control diseases, provide basic medical services, and treats a large number of patients every day. It is especially important for people with low income because they can access healthcare at a lower cost. In many cases, public hospitals are the first and most important place for people to receive treatment. On the other hand, private healthcare contribute by improving the quality of medical services. It supports early diagnosis, offers more personalized care, and use modern medical technology. This helps patients receive faster, more accurate, and more comfortable treatment. In addition, private hospitals help reduce pressure on public hospitals by treating patients who want better service on shorter waiting time. From a medical point of view, both systems work together to diagnose disease early and correctly, provide effective and timely treatment, and improve public health and quality of life. They also help people live healthier lives and reduce the risk of serious diseases in the future. In our opinion, there is no perfect healthcare system. Each system has its own strengths and weaknesses. The best solution is to develop public and private healthcare at the same time so they can support each other and reach Public hospitals can focus on serving a large population and handling serious cases, while private hospitals can focus on service quality, innovation, and advanced technology. When the two systems work together, patients can have more choice, better access, and improved treatment results. In the future, Vietnam should continue to improve its healthcare system in several ways. First, the government should invest more in medical equipment and facilities in public hospitals, especially in rural areas. Second, private hospitals should try to reduce treatment costs so more people can access high-quality service. Third, it is important to train more skilled doctors, nurses, and healthcare workers because they are the key to good medical care. In addition, cooperation between public and private sector should be strengthened to share knowledge and improve healthcare quality. Finally, people should also take responsibility for their own health. They should have a healthy lifestyle, exercise regularly, and go for regular checkups. Prevention is always better than treatment. To conclude, good healthcare is not only about hospitals, doctors, or technology. It is about how well a country can protect, maintain, and improve the health of its people. That is all we have for today. Thank you for watching.